I'm joined today by Ruth, the Executive Vice President and Chief Operating Officer of Sparrow Health System in Lansing, Michigan. In this episode of Tuning Healthcare, Joe and I will discuss the impact of COVID-19 in Lansing and how a critically important implementation of social distancing has helped them offset a major crisis in Lansing. How this crisis has further illustrated that healthcare is local and the difference in response to Detroit, to Lansing, and other parts of the country. And as they think about the future of Sparrow, how critical it's been that they have invested in a health plan, PHP, and launched a Medicare Advantage plan, and how you need to move away from fee-for-service and take responsibility for managing the entire premium dollar. Join Joe and I as we tune healthcare. Joe, thanks for joining me today. Truly unbelievable times in healthcare. But before we delve into COVID-19 and the impact to Sparrow and Michigan more generally, would love to just learn a little bit more about how you got into healthcare. Obviously, a Michigan native and spent a lot of your career there, but how did you get started?
Actually, purely by accident, a summer job. I had an opportunity. I worked on the loading dock of Saginaw General Hospital. Saginaw, Michigan is my hometown. And one of the most enjoyable and also excruciatingly difficult jobs I've done. The Gordon food truck would back up and offload 80-pound, crates of food that you had to throw onto the back of carts and things like that. And so my first real experience inside a hospital, kind of from the inside out. And so unloading the trucks and pushing supply carts and leaving big gashes in walls of hospitals was my first introduction into that. And second summer, I had an opportunity. Actually, they had an opening in the business office. And so I got to see from the business office side how those things kind of came together. And after I got out of college, I said, that was a really incredible experience. Its own little community, its own ecosystem. And so I started down that path really through finance and now more on the operating side.
That's great. And I see a Spartans jersey in the background. Is Michigan football the true love?
Michigan State sports of all nature. I think we were robbed this year of our NCAA basketball charge that we usually make. But living in East Lansing and a part of the community, we do live and die by our Spartans. So hopefully football season will be allowed to move forward this fall.
Yeah, it's truly unbelievable. Just the impact of COVID-19 across the board. Obviously, I'm, as you know, from England, and we've had a prince with it, a prime minister, soccer players, right, as well as everyone who sort of we would consider ourselves sort of regular people. So the impact has known no bounds. So talking of COVID-19, how are things in Lansing?
I think some of this flattening of the demand curve has played out here in our community compared to others. We have certainly taken care of our fair share of patients, but we haven't seen the huge and overwhelming spike. It's been more of a steady and consistent flow.
So Joe, it's fascinating how often how little we seem to know about this virus. On the last episode of Tuning Healthcare, we had Anish Chopra who spoke about the data inadequacies that we have as a country as it relates to public health. Even if you know well within the Sparrow Health System, who's been admitted and who has COVID-19 and what the demographics of those people are. the ability to transmit that data in a meaningful way to the CDC for them to look at patterns and the like is obviously a failure of our public health system. But within Michigan itself, like, it's fascinating how localized it is, right? I've done that drive from Detroit to Lansing many a time. It's, no more than an hour and a half. Yet Detroit seems to have a lot of COVID-19, and Lansing, as you just articulated, seems to be doing okay. What do you put that down to?
That is the question that we all keep asking ourselves. I do think that the adoption of some of the social distancing played out differently in different communities. Been fascinating to see some of the cell phone data that comes out, and it's basically showing who's staying home and who stayed a little bit more mobile. And I think kudos to our community. I think they took that really seriously and locked things down pretty early, pretty tight. And I think other communities were a little bit slow on the uptake. Just one of a million contributing factors. I think in retrospect, we'll understand this so much better than what we are understanding in the moment. I've heard a whole bunch of theories in terms of what went on in Detroit, large conventions, people from out of the state coming in, a lot of people touching different aspects of the community as at least theories. And perhaps some benefit for some of us that live in more mid-sized communities. Sometimes we lament the fact that we don't have all the restaurants we want or things like that. But I also think that Lansing being the state capital, when the governor, who is actually from Lansing, gets on TV or sends out an edict and says this is what we need to do, we may be a little bit more compliant than others just by that location as well.
Yeah, as I said, fascinating. And if that truly turns out to be the case, that the main reason is effective social distancing, it's going to be an interesting study in how we deal with these things in the future, right? And obviously, if we have the right data, we can social distance, locales rather than states, which obviously, from an economic perspective, would be far better. And so, talking about the economic impact, what is the economic impact to Sparrow? Obviously, you've stopped elective procedures. You don't have the tidal wave of COVID-19 patients. I'm sure it must be difficult for you.
Yeah, if I could, though, one other key point that I think has been hugely beneficial to our organization, we have an incredible clinical laboratory as a part of Sparrow. It's actually one of the top 25 busiest labs in the nation. And we have some incredible scientists working in that laboratory that actually helped us get to a testing standard and level where we weren't dependent on others providing us all of the materials to do so. And so I think we have also been able to test with much shorter turnaround times, 4 hours instead of 4 days or 40 hours or whatever it played out. And so I think our ability to actually identify and isolate patients early on in the process also served us extremely well here in Lansing. To the question of the economic impact, still trying to figure out all of that. But like you say, unfortunately, in healthcare right now, much of the payment is for procedural work as opposed to medicine work. And that's really, the care for these COVID patients end up in a hospital bed under intense scrutiny with lots of physicians and nurses and anesthesiologists and respiratory therapists caring for them every moment. And those types of cases typically aren't recognized as a high resource consumption and therefore reimbursed at a much lower rate than, say, an open heart procedure, a orthopedic procedure. And so as we shut down early, I think Sparrow was an early adopter in slowing down and then stopping elective procedures. We certainly decreased our daily census by probably 150 to 200 patients per day on any given day. And those are typically the things that pay the bills in healthcare. And so tallying all of that up, certainly some of the federal money that has come our way has been helpful, but doesn't come anywhere close, to backfilling that gap. So I think we'll look back on this and try to figure out what that deficit is. But Sparrow was very fortunate going into this crisis, having a very strong balance sheet, and has been able to weather the storm. There are certainly a lot of friends that I talk to across the country that are incredibly concerned, one, getting through this, and then really what their capabilities are on the backside.
Let's elaborate on that a little bit, right? Thankfully for Sparrow, as you said, a strong balance sheet. What do you think happens to systems, the ones you've spoken to, that are not as well managed, or are in a rural area that never afforded them the luxury of building a stronger balance sheet? What happens to those systems?
Yeah, I think it'll be a gamut of responses. You really hit on an appropriate topic. I think rural healthcare is one of those really challenged areas. Sparrow has 4 community hospitals in our region, one of which is really, really struggling. And if they weren't a part of the system, would have probably closed their doors many, many years ago. And I think this will really put an emphasis on those types of small community providers all across the nation. There will have to be some consolidation if they've been trying to remain independent. I don't know that they'll be able to do that. All of us are going to have to rethink our strategic plans, our capital investment plans. Healthcare has been a pretty challenging environment financially for the last handful of years, and then to take a big chunk of working capital away from health systems, a lot of these things I think will come to a screeching halt, and you certainly have to reprioritize. There will be programs that get closed, and I'm very fearful probably many hospitals that get closed at the back end of this.
Stay on the rural hospital scenario, because if a hospital closes in certain metropolitan areas, there are choices, right? It's potentially not the end of the world for patients in that region, but in a rural area, that might be the only hospital that's within quite a distance for those patients. So what happens in that rural community? Let's assume that the large players who are within reach decide our balance sheet's been damaged by this. We're not in a position to go buy additional hospitals. Does the government have to come in? Does the state come in and have to try and prop it up, or what happens to the rural hospital in the scenario where they don't have the balance sheet and they don't have someone who's willing to come in and merge with them?
I think there are a handful of rural hospitals that never took advantage of the critical access status that was granted probably about a decade ago. We actually have one of those hospitals as a part of our portfolio as well. Critical access creates some additional reimbursement that certainly helps things along. For those that don't have any support from a system or systems willing to come in and support, I think the inability to access care locally will have devastating impacts to those communities. In some communities, one in particular that we just built a new hospital in not too long ago, it's the lifeblood of those communities. The mayor was on the hospital's board and said, if we don't have access to health care and if we don't have good schools, we will not have employers, and our community will continue to shrink and go away. And so I think it's multifaceted, from the health of that community to the economic health. Local hospitals and healthcare systems play a vital role. And I know there's been a lot of conversation about the affordability of healthcare, and now we've turned around and are pouring trillions of dollars back in to fight this pandemic. And so I hope there's a rebalance of that conversation to say, what is the totality of the role that these community hospitals play? And again, many of these hospitals, they have an emergency department, and that's really a patient's first stop getting care, getting stabilized, and should they need something more uh, tertiary, quaternary, an access point then to get them to the right place for the right type of care. And again, without that, people will be driving 30, 40 minutes, 30, 40, 50 miles just to get to that first ED, let alone to the end destination for them. And in so many of those things, that time is the difference between life and death.
Yes, and in addition to the medical impact, obviously there's also the economic impact. One of the things that I've always admired about Sparrow, the system, and also you and your colleagues is you're so connected to Lansing, right? It's an integral part of who you are and the community you serve, and probably for the people of Lansing, similarly, Sparrow is an integral part. And so, how do you see the economic impact to a city like Lansing? What are you seeing around the community, the sort of knock-on impact of the virus to sort of non-medical industry?
First and foremost, there's been an incredible thing that happened here in Lansing. We have an economic development organization that brought together a lot of manufacturers and things that just wanted to help. And so some of them have retooled their operations to provide and manufacture face shields. They've reached out to other folks that are helping to create disposable gowns. And so there's been an outpouring of community that wasn't necessarily healthcare related that have actually come through to do that. Now, there's a local paint store that had some N95 masks, and they said, hey, they're sitting on our shelves. We obviously aren't going to be using them anytime soon. Can you come over and pick up a couple of cases? And so there's all of that in totality, but certainly the small businesses are in a world of hurt. And, restaurants and things like that run on a very slim margin. Again, smaller communities, probably it's a little bit easier to rally around them and buy local and, get your takeout food from your favorite restaurant and things like that. But there will certainly be businesses that won't make it through this. Sparrow is trying our very best to make sure that all of our caregivers are gainfully employed, and if not, able to access some of the government support systems. We've taken people whose normal role, say imaging, radiology, not as busy. We've repositioned some of those caregivers, and they're now our screeners at all of the entry points into the hospital. And so they're asking us the COVID questions and taking our temperature. And if we pass, we get a little ribbon that goes around our name badge so that we can go into the premises and things. But as our own almost ecosystem, we run the gamut as well. We have an incredible health club that's a part of Sparrow, and all of that has been obviously shut down. It's not as easy to reposition those people, and so they're being challenged by that. We're making as positive a decision as we can each and every day. We've avoided the massive layoffs. We've avoided the massive pay cuts. If this were to go on for months and months, I don't think that that's a possibility, but we've tried to make sure that our physicians, even if they aren't able to work in their practice, that we've positioned them in part of our surge plans to maybe go to an alternate site of care and be able to take care of patients. We've instituted virtual visits. We had actually planned a large launch of a virtual platform in May, and in the moment, pivoted, dropped a couple of different products into the community specific to COVID screening and conversations, and got them up in the matter of weeks. And so it's amazing what you can do when you run out of all other options. And I hope some of that level of innovation and ingenuity actually carries on and over in a post-COVID world, because we've done some incredible things that we would have all told ourselves there's no way we could possibly do that quickly and do it well. And so there's a lot of great learnings that will also come out of this crisis.
Yeah, undoubtedly. So let's turn our minds to sort of coming out of it, right? Because one of the concerns that we all have, right, is we weren't prepared, as you mentioned before, around testing and others. Thankfully, Sparrow was, but as a country, we were less prepared in some of these areas. So, and one of the concerns is, do we have a plan to come out of it? And so, as a chief operating officer, right, executive vice president at Sparrow, sure, it's something that consumes you sort of every day, and maybe every minute or every day. And so, as you sit here today, what are your top 3 priorities that you're focused on as you think about coming out of it? Obviously, let's assume you put in place the fire extinguishers that you need to make sure that you deal with the fire if it hopefully doesn't spike in Lansing, but if it does, it sounds like you've put that in place. But thinking, coming out of this, hopefully a couple of months time, what are the top 3 priorities that you think of for Sparrow?
Funny you should ask. We just had a really long conversation this morning with our senior leadership team, and we have been all hands on deck in terms of standing up incident command and really taking care of the community. And the data is starting to show, when you start talking about doubling rates and things that we're all now becoming experts on, statistical analysis, right, and predictive modeling and things. We do think that for our community, we are starting to see that curve not only flatten but turn down. And so we're talking about the restart, right? And what does that look like? And we couldn't, just say tomorrow, hey, back open for business, not by any means. And so we're going to actually start to be very as deliberate as we were standing up incident command, moving cases out of the health system. We're going to be equally deliberate on this restart. And so we're going to start talking to our physicians about the prioritization. Who haven't they been able to see? Who haven't they been able to treat? And how do we start to bring that back online? And not knowing, we will still follow the governor's orders and all of this. So the current orders are through April 30th. So I think we at least have a couple of weeks to think through what the restart is. And we should also be preparing that if it isn't that May 1st time, what does it look like after that? No magic bullet, but I think it's really going to be focused on the people most in need. We have seen a lot of elderly patients not coming in to see their doctors, not talking to their doctors. You've probably seen on the national news, the number of deaths at home has skyrocketed across the country, certainly in big cities like New York and even in Lansing, where the statistics play out. We've seen people arrive at the emergency room too late to save them, with cardiac issues. And we're trying to now be proactive to call out to all of our patients and reassure them that if you're needing to come in, come in. And so I think we're going to start with those key services first. I think we'll certainly do that within the primary care, which is kind of that first line of defense, get that stood back up, open and available, both on a face-to-face basis and more on the virtual side of things as well, and slowly bring things back on. Can't do that too quickly, because if there is a resurgence or rebound, that would put a lot of people at risk. So if you talk to me in a couple of weeks, I'll have a much better plan than I do in the moment. That's really been more of a new thought for us than anything else.
So as you think about that rolling recovery, for want of a better word, rolling renewal of services, is that sounds clear to me from what you just said, which is wouldn't have expected anything else from you, Joe. Focused on the patient first, right? Which are the patients that are in need? Obviously at the same time, you have to marry a clinical model with a business model. What are your thoughts about? Are there going to be ways to recapture some of the lost revenue, or do you just feel there's just going to be a hole that you just won't be able to recapture?
I think there will be a predominant hole that we just won't recapture. Something that is more elective, right? Say a hip or knee replacement. The people that were scheduled to have those, I assume will still want to get that done. Typically people don't often schedule cardiac cath events, right? They usually show up in the emergency department in great distress. And again, I think there are some people that have missed out on that. So there will be a hole. There's just no doubt about that. There won't be nearly enough federal money or state money to ever fill that back in. But some of it will certainly be caught up. The oncology area, we have a fantastic cancer center, and again, not able to treat and take care of all of the people that they want to in the same fashion. That will certainly come back online sooner than almost anything else.
And you spoke about telehealth and how you had a rollout in May, figured out how to roll it out much quicker. Do you see that playing a bigger role going forward for the Sparrow physicians and the patients being more willing to accept that as a mode of receiving their healthcare?
Both patients and physicians are probably struggling with that right now. It was something that we hadn't jumped on like many others had. It hasn't been a huge adoption rate, which we've seen across the partners in the state when we've asked. And so I think it'll be just another access point. But I don't know that will, certainly it'll pick up pace. I think it'll have a stronger adoption rate than it had on its own. But I think it's just going to be one more issue. It certainly won't fix all of those problems. And, our physicians like the video aspect of it. It's still not the same for them to be able to, especially for some of their fragile patients, to really look them in the eye, take a look at them from head to toe, and see where they're at in their care. So we're hopeful. Like I said, we've learned a lot. We'll be better video visit aficionados when we go full blown in May, but I don't think that will overtake the in-person visit anytime soon.
Let's switch topics. Sparrow has been a leader in population health strategy. You've been a leader in Michigan. You've had a health plan, right? PHP for many years. You recently decided to expand into Medicare Advantage. We obviously at Lumeris are fortunate to be your partner in that part of the health plan and in the endeavor to deliver an excellent MA plan to the people of Lansing and the people that you serve. Tell us a little bit about Sparrow's population health strategy and how the sort of MA plan fit into that strategy.
Yeah, that has been one of certainly the more exciting developments for us as a health system. I think as we understand both the delivery of healthcare and the financing of healthcare, hospitals are typically a little bit lower on the food chain as it relates to the total premium dollar. And if we're always going to be beholden to somebody else, we didn't think that was in the best interest of ourselves nor our patients. And so Medicare Advantage was one of those marketplaces that we didn't really have a presence, and we knew that we could make an impact. We get to now take a look at the whole premium dollar that comes in for the Medicare patients and perhaps reposition that in better fashion, right? If we have better preventative care on the front end, say through our cardiology practice, that maybe we actually start to avoid those emergent cardiac cath procedures, open heart procedures, because we're catching the disease earlier in its path and intervening earlier, be it with procedural work or medicine and things. And so that's the exciting part for us. I think it really puts us where we think we belong in the health system, is helping our patients get the best care, the more affordable care. And that was a big driver in our strategy. Our health plan has always been really well received, but we didn't always reach all of the marketplaces that we wanted to. And Medicare Advantage opened a door. Those patients are already in our community. They have choices. And as we attach the Sparrow brand to that offering, the Sparrow brand held really strong. So many people chose to join our health plan because it wasn't only PHP that they might have known while they were employed, but just the trusted Sparrow brand. And we've seen that in Lansing, and we've partnered with another health system called Covenant in Saginaw, Michigan, that we put their brand onto their product with the exact same response from their community. And so I think, again, it comes back to healthcare is incredibly local, who is trusted. And I think the faith that our community and our region has in Sparrow was both answered and rewarded with this Medicare Advantage product.
And brand undoubtedly is a key factor to differentiating an MA plan, and the brand of Sparrow, as you said, is second to none in the Lansing area, as Covenant's brand is in Saginaw. But of the 107 odd provider sponsored plans that exist in the country, most underperform. PHP, on the other hand, has been, in recent time at least, successful. And what'd you put that down to?
I think it's the marriage of not only the plan, but our population health platform and our employed physician group. So much strength and focus around that. We actually started down the pop health road before we really turned our attention to PHP. And so we organized our physicians, both primary care and specialty, into a clinically integrated network, and really started looking at how we improve the way we delivered care, putting ourselves in position to take on risk and to take on delegated responsibilities that plans often held. And so we had a running start with that, and then married with a health plan, that is literally just 2 buildings down. And so if the health plan has an issue, or if we have an issue with the health plan, they can't hide from us, right? If somebody's health plan is hundreds of miles away over that distant phone line, it's really the connectedness and the teamwork. And we see this as a holistic endeavor. And so we remind the health plan from time to time, stop acting like a health plan. And we also remind our physicians from time to time, stop acting like this isn't part of the family. And we've had those conversations over the year to where we are right now, a very mature integrated group. And I think that's going to distinguish our performance from so many others.
Yeah, I think that's right. And you spoke about the ability to manage the entire premium dollar, which obviously for a health system, moving up the premium dollar is, I would argue is so important, right? As fee for service comes under pressure. To me, one of the ironies of the COVID-19 crisis is that many health systems felt there was safety in fee for service, and actually what they're finding is there actually might not be safety in fee for service, and therefore, I would look at it and argue, taking greater control of the premium dollar was not only wise, but maybe will be critical for health systems. But that's obviously my perspective. How do you see it? Sort of the impact of sort of COVID-19 on sort of what we broadly talk about as population health, which I define as health systems moving up and managing populations, and as a result of that, taking control of more of the premium or premium equivalent dollar. Do you see that will make you move faster? I'm interested in your perspective for Sparrow, and then also what you think more broadly for the industry.
I think it will have a huge impact. I think fee for service has been a challenge for a long time. When you get paid for what you do, and again, where most of that payment is on the back end of very high, very expensive procedures and towards the end of life. And if we can reposition the spend towards more preventative medicine, being more connected, providing greater access to our patients, the care will be better at a lower cost. There'll be a happier physician involved. There will be a happier patient involved. Where fee for service, I think, really kept people locked into almost that treadmill effect, right? If you needed more money, you had to do more things, not the right things all the time, just more of the same thing. And so I think as healthcare providers, we have a an opportunity to really reset what we think is important and how best to care for patients. And so, yes, I think that it's a conversation we may now get to have with employers, that we may now get to have with others too, in light of what they've experienced, for their employees through this crisis. There's a lot vested in the old fee-for-service world, and so many will hang on to that for as long as they can, because that's probably to their benefit. But I think even as a health system, we see quite honestly, the need to employ more and more physicians, where that used to be another variable. We're all under the same economic tent, and we get to have different conversations about how we should go about providing care. And now if you add the premium dollar into it, how we spend that collectively, where there was a lot of competing interests for that conversationally prior to that. And so there's a lot changing, and as we said about the impact, I think some of the smaller private practice physician groups are probably struggling just like any other small employer. A handful of folks that are dependent on that fee-for-service money to pay for that, and now they've literally all been out of work for about 30 days. And so we're doing what we can to help support them in this time of need and transition as well. Things like if they rent space from us, we've given them a rent holiday for at least a couple of months, knowing that they don't have any income coming in. Things like that. We've really been trying to reach out and provide them with the resources as well.
Great. Joe, I like to end with what I call the quick fire round. Just a few quick questions. Best piece of advice you've ever been given?
I always say, typically in many situations, you have a choice that you can either choose to laugh or to cry. And I always make sure that I choose to laugh. I think humor and laughter is a great course of medicine. And I always make sure that we keep doing that, even in the heat of battle. I think it makes a huge difference.
Couldn't agree with you more on that one. When you're not supporting Michigan State sports, what do you do to relax, have fun?
Oh, well, in Michigan, certainly some of that's weather dependent. I do love to play a little bit of golf. I wish I was good at it, but I at least enjoy it, and I love the fresh air. I love to travel. I love to get out and get around. In the winter months, I prefer to travel somewhere warmer. We've got 2 college-age daughters that have returned to the nest, not necessarily of their choosing, but we have a wonderful family, and so even spending time together there throughout that time, either going to visit them or having them come home, is all part and parcel what keeps us pretty busy.
Joe, thanks for joining me today. Thank you for continuing to be a great partner to Lumaris. We appreciate it, and we hope that you stay safe and well in Lansing, and we look forward to a day when we can continue this conversation in person.
Thanks, Nigel. Great catching up. Thank you very much.
Thanks for joining us for this episode of Tuning Healthcare. It's incredible to have the opportunity to speak to people like Joe and his colleagues who are at the front line of saving us and protecting us during this incredible time. Don't forget to follow us on your favorite streamer, and please take a moment to rate us, as it helps others find this podcast. Stay safe, and please join us next time as we look to further tune healthcare. This is Nigel Orenstein in New York.